Your gums could be destroying your dental implants. What you should know. Hi there, my name is Dr. Clarice and I will be your dental implant dentist here at Toofus Dental. Dental implants are often considered a long-term solution for missing teeth, but their success depends heavily on gum health. Patients with a history of gum disease have up to a 74% greater risk of implant failure and a 4-fold higher risk for developing peri-implantitis. But why would my implants be affected by bacteria if it's made of titanium? The key principle is that implants are still housing gum and bone tissue, which are still susceptible to bacteria in the mouth. They rely heavily on a healthy environment to remain stable. For this reason, a full periodontal assessment is essential before implant placement. This includes evaluating infection levels, bone support, and patient-related risk factors such as smoking and diabetes control. A stable foundation is critical for long-term implant success. If you are looking for someone to make sense of your current oral health issues, feel free to drop us a message.